This is 22 News in Focus.
Good afternoon and welcome to 22 News in Focus. I'm Don Shipman. February is Heart Health Month, and our topic of discussion today on 22 News in Focus, heart disease. It is the leading cause of death in the United States for both men and women. The good news is that advances in medicine and personal lifestyle choices are helping those with the disease live longer and preventing it from developing in many other people as well. So, joining me here today to discuss heart health are Dr. Aaron Kugelmass, Vice President and Medical Director of the Heart and Vascular Program and Chief for the Division of Cardiology at Bay State Medical Center. Also today we have Dr. Thomas A. SCHWANN, and he is the Associate Director of the Heart and Vascular Program and Chief of the Division of the Cardiac Surgery at Bay State Medical Center. So thanks for joining us both here. Let's start right from the top and ask, what is heart disease? And we'll start with you.
Heart disease, takes a broad spectrum of things, abnormalities in which the heart is actually formed in children or in utero, all the way up to blockages of the arteries that supply blood flow to the heart, abnormalities of the muscle, which is really what the heart is, abnormalities in the way the heart activates or its conduction systems, and abnormalities of its valves, and then abnormalities or diseases of the blood vessels that the heart pumps into.
You mentioned children, so Dr. SCHWANN, explain to me the differences in heart disease in a child, for example, and an adult.
Yeah, that's a good question. So, number one, thank you for the opportunity of being here and share some of our viewpoints with your viewership. So, adult cardiac disease, as Dr. Kugelmass already explained, is sort of a combination of either the muscle, the valves, or the electrical conduction system. In the child, it's typically a structural abnormality where the right side of the heart and the left side of the heart are either malformed or not formed. So very, very distinct differences, and the manifestations are very different. In an adult, it is typically associated with heart attacks or heart failure. In a child, it is a manifestation of the fact that there is oxygenated blood on the left side of the heart and deoxygenated blood on the right side of the heart, and sometimes those two circulations are abnormally affected. So folks who are young will typically have what's called a blue baby syndrome, where there is circulation of oxygenated or deoxygenated blood where it shouldn't be. And it is that mixing between the two that is frequently a source of abnormalities in a child.
Is there something that child will have to live with for the rest of their life?
Some of it is correctable and some of it is not correctable. With advances in approaches to try to address some of the valvular problems in children through catheters, it obviates the need for an operation, or alternatively in the more advanced forms of congenital heart disease, there's certainly reconstructive techniques that have gotten better and better and better, and the results are dramatically improving in terms of patients' quality of life as well as their longevity.
And as far as adults go, are there different, types or ranges of conditions when it comes to heart disease?
Well, there's certainly, for any given condition, there's the mild version and then there's the severe version. But again, at least the way I think about it as being a disease of the muscle, an inability to contract, or in fact, an inability to relax, okay, and that's an active process. Abnormalities of the valves. The heart has 4 valves to keep blood moving in the correct direction, and over time, or because of infections or other conditions, those valves can fail. They can either become too stiff to open, or they allow blood to flow in the wrong direction. Then there's a wiring system, literally a conduction system for the heart, and with age, that tends to sort of wear out. And the wires get frail. And then lastly, and this is, I think, the thing that most people associate with heart disease, is the buildup of cholesterol and other problems inside the arteries that supply blood to the heart. And that's really what most heart attacks are about.
And I think one other element that I would like to add is that we're really experiencing a catastrophic set of circumstances related to the opioid epidemic, so that folks who have a substance abuse problem are at very high risk for developing infections on their valves. And the infections on the valves essentially destroy those valves. And we have seen a tremendous uptick in folks who have what's called endocarditis, which is an infection on the valves, either resulting in a localized infection within the heart itself, or valves that are becoming leaky and require extensive reconstruction. But this has been a significant problem both in our community here, regionally, as well as across the nation.
You mentioned opioid. Is that because of like intravenous drug use, for
Correct.
example,
Correct.
because of infection that can cause, and that can cause an infection on the heart itself?
Correct.
And that takes a long time to detect, doesn't it? Oftentimes,
it
or
can
no?
often be indolent for a while, but when it comes on, it's pretty dramatic. And then there are a variety of different criteria that establish that in fact is what's going on. But it can sort of fester along for a reasonable period of time, but ultimately it will become quite apparent.
What are some of the causes of heart disease in general? And let's talk about, I guess let's go with adults, I suppose, or maybe it's the same for young people and older people.
Well, I think what happens to older people probably starts when we're younger people, and a lot of it has to
Interesting.
do with lifestyle. So what we eat, whether people smoke, whether they're active or inactive, whether they have diabetes, and there's a epidemic of diabetes in the United States, including amongst the young. So things start early and then they progress through life. And so what happens in adults really starts in children and then gets accelerated in the adults. But a lot of it is lifestyle and other prevention. You don't get to choose who your parents are, and there's certainly a genetic component to what we would call acquired heart disease, but a lot of it can be modified.
Some of the symptoms. What are some of the symptoms?
So heart disease has a wide variety of symptoms, but a lot of the symptoms can be summarized in 3 or 4 specific complaints. Typically, folks will complain of chest pain. That's a classical, sort of Fred Sanford, Elizabeth, this is the big one, right? Alternatively, in females, that's a lot more subtle. Ladies will manifest heart disease or heart attacks in very nonspecific patterns. Fatigue, not feeling right, the classical sort of Hollywood chest pain, heart attack sort of scenario is much less common in females. Breathlessness, inability to do what folks were able to do in the past, lack of energy. And then in its most tragic form, it presents as sudden cardiac death, where folks do not know they have heart disease, and the first manifestation of their heart disease is a cardiac arrest. I've had a very close personal friend of mine who was a surgeon in St. Louis who actually collapsed during Thanksgiving dinner and was not able to be resuscitated. That was his first manifestation of underlying heart disease.
After a short break, we're going to continue our conversation on heart disease. You're watching 22 News in Focus. We're back here now, 22 News in Focus. Today we are talking about heart disease, the most common cause of death in Americans, both men and women. And our guest here this afternoon, Dr. Aaron Kugelmass, Vice President and Medical Director of the Heart and Vascular Program and Chief for the Division of Cardiology at Bay State Medical Center. Also, Dr. Thomas A. SCHWANN, Associate Director of the Heart and Vascular Program and Chief of the Division of Cardiac Surgery at Bay State Medical Center. Let's talk about Bay State because I want to know the Bay State Heart and Vascular Care Center. What types of treatments take place there? We'll start with you.
We take care of just about everything,
Okay.
from soup to nuts, except cardiac transplantation and the correction of congenital heart disease, complicated congenital heart disease. But pretty much any other manifestation of either heart disease or heart health we provide to the Western Massachusetts community.
And Dr. SCHWANN, what are some of the current trends when it comes to cardiovascular care?
So I think that there's an increased focus on outcomes and quality. I think we've been talking a lot about quality in healthcare, and that dialogue is obviously not only here, but nationally and regionally. And cardiac surgeons have always been on the forefront of trying to improve quality. About 30 years ago, our professional association, the Society of Thoracic Surgeons, has come up with a database where essentially all the cardiac surgeons report their outcomes into this database across the United States, so over 1,000 hospitals. And the Society of Thoracic Surgeons adjusts that information, risks adjust that, and gives us a report back saying, look, you are either underperforming your peers, you're performing as expected, or you are overperforming and superperforming your experts or your peers. And I think that report card that occurs to us on a semi-annual basis gives us an understanding as to where we are, what needs to be corrected, how we can change things, how we can improve things. I'm happy to report that Bay State has had a spectacular year over the last 12 months or so, where we are actually been placed in the top 1% of all the heart centers in the United States in terms of outcomes for cardiac surgery. So we're very proud of that, and it's a reflection of the wonderful team that we have, the cardiologists, the nurses, the anesthesiologists, everybody that cooperatively and collegially delivers the kind of care to our patients to produce those kind of outcomes. In terms of what else do we do, I think that we are trying to be as effective as possible, but try to leave as little scar as possible. So we are moving away from big incisions to small incisions. We're beginning to focus on artificial intelligence and trying to assess the risk for our patients and predict that risk for our patients so that the patient can have a reasonably well-informed opinion as to whether the operation makes sense for them in terms of balancing the risks and the benefits of the various operations and the alternatives proposed to them.
Dr. Kugelmass, let's talk about the artificial intelligence aspect of this. What is it called? The Da Vinci machine? What was that one? And that might be way dated now. I don't even know.
No, it's not dated. I'll let Dr. SCHWANN address that. But that's really a robotic system for surgery.
Okay, so that wouldn't be considered artificial intelligence.
Well, I think there's certainly a lot of programming that goes into it. But I think artificial intelligence often really refers to the summation of large amounts of data from large populations to predict either adverse outcomes or other problems. And in other ways, we've used that to identify patients at risk and try to tailor therapies in what we would call primary prevention, which is prevention of heart disease in the first place. Primary prevention is to prevent the heart disease. Secondary prevention is to prevent it from getting worse. And so I think the application of artificial intelligence would sort of fit into those risk models that are based on large populations. And we can, there are apps for that on your cell phone. So if you come into my office, I can tell you what your risk of 10-year risk of developing atherosclerotic cardiovascular disease is. So perhaps that's where we're thinking about artificial intelligence.
Okay. All right. You guys mentioned too a sense of balance. So how do you determine when surgery is necessary?
I'll let the surgeon address that first, and then I'll pipe in.
Dr. SCHWANN.
All the time. No, just kidding. I think that again, what I've mentioned, it's a team approach. It's a collegial, multidisciplinary, cooperative approach to our patients. What has happened over the last 20 to 30 years is that there's been an explosion of information, and it becomes impossible for one expert to be able to deliver the comprehensive care for our patients. And so we have a team. We have a heart team. So for example, when a patient comes in with a heart attack or with blockages in their blood vessels, there is the possibility of giving them medications. There's the possibility of performing a stent procedure, or there's a possibility of doing an open heart operation. And it requires a cooperative understanding and a cooperative discussion, the risks and benefits of each approach, and then of course having a conversation with the patient in what we call now a shared decision making. What is important to the patient? What is it that we can offer that patient? And really understanding what the patient wants, and then we can structure the delivery of care based on those wishes. But it is really a team-based approach, and then through a very frank discussion and discussion between various experts that we come and distill the most appropriate answer for an individual patient. And for a given condition, depending on the patient's preferences, that may entail a stent or that may entail an operation. Really depends on the individual circumstances and the particular needs of the individual patient.
Heart disease is preventable. We're going to learn more after the break. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we are talking about heart disease and the most current treatment procedures. As medicine advances, the recommendations for evaluating and testing of patients changes. So what we know is that heart disease is, in the majority of cases, is preventable. And it begins with primary care physicians. So let's talk about that. When a patient comes in, what is that conversation like?
That's, again, an individualized discussion between the primary care provider and the patient, but it would be an assessment, a verbal assessment at first of identified risk factors for heart disease. So, do they smoke? Are they sedentary? Do they have a history of diabetes? Do they have hypertension? Do they have high cholesterol? Is there a family history of heart disease? Much of it's preventable, but a lot of it has to do with environmental factors that then have an interplay with one's genetic makeup. And as I said earlier, you don't get to pick your parents. What you do get to pick or do is try to reduce those what we call classic risk factors. And then there are other risk factors that have emerged. But it would be screening for cholesterol, screening for high blood pressure, and then a variety of questions around what we would consider a healthy lifestyle.
What are the recommended treatments for the most common risk factors?
I think that the Kugel must be better served.
Okay.
And that's more of a medical
All right,
approach. There are very clear guidelines that have been established for the treatment of high cholesterol when one works with diet alone, when one initiates drug therapy, most commonly a class of drugs we call the statins, which have been around for a number of decades and are amazingly effective at lowering cholesterol and have been proven to reduce the risk of either first heart attack or second heart attacks or strokes in a very dramatic fashion, and probably are the greatest cause for the reduction of heart disease deaths and prolongation of life. Adequate treatment of high blood pressure. The targets for high blood pressure vary and they move around from year to year, but currently a blood pressure of less than 130/80 is the standard, and 120 to 130 is considered at risk.
Should everyone check their blood pressure on a daily basis?
I think patients who are having their blood pressure treated at times should do it on a daily basis or certainly on a weekly basis. I think patients who have normal blood pressure, and that's been documented over time, need not check it on a daily basis. Blood pressure changes relative to whatever it is we're going through. So if you're stuck on the highway trying to get to an appointment, your blood pressure will go up.
It'll go up, yeah.
Okay, if you've been under the covers at night and you're all vasodilated, your blood pressure will go down. So it varies throughout the day and what the stimuli are.
I think it's worth pointing out, too, that all these public health measures and all the medications and all the efforts of the various folks who are involved in preventative measures has really had a dramatic effect on the impact of heart disease on our population. So over the last 10 to 20 years, we have actually decreased the mortality rate from heart disease by over 50%, which is a dramatic accomplishment. In the 1960s and in the 1950s, folks were really dying of heart disease at a much, much younger age, and that has just been eliminated through this combined efforts, both from the public health perspective as well as from some of the medications and some of the sophisticated treatments that are available.
And you mentioned earlier, too, that heart disease is different for men and women, presents differently. Why is that?
So I don't have the answer to that question, but I think some of the hypotheses or the reasons that have been put forward is that obviously the hormonal milieu or the hormonal differences between males and females. Typically, females are relatively protected against heart disease until menopause, at which point they catch up with us. But yes, the symptoms are very different, and the classic symptomatology that I've been taught in medical school may not be as applicable to females as they are to males.
So that makes it a little problematic for women. What are some of the things that they should be looking for? And I bring that up too because oftentimes women are the caretakers in any kind of family environment or family unit, and they're thinking about other people around them, and the last person they're thinking about is themselves.
Correct. So again, it's typically a more subtle presentation, although I've taken care of a lot of heart attack victims over my career, and I've met plenty of women who had the classic signs of an elephant on their chest. But the more subtle symptoms would be a gradual loss of energy, a sense of malaise, vague nausea, as it was mentioned earlier, breathlessness or inability to catch one's breath. And I think we're very good at adapting to our limitations. And so over time you have to ask yourself, am I still doing as much activity as I used to, or have I reduced my activity level to accommodate something that's going on?
That can be difficult to kind of recognize, I think, though, because I think we automatically just, when we're feeling tired, we accommodate for that.
Correct, but and this is one of the things I learned in medical school very early on from a very wise professor, which is not just the question of are you having symptoms, are you short of breath, but tell me what sort of activities you did a year ago, and what sort of activities can you do now? Now, happily, many people go back to the gym and are actually doing more, but if you in fact reduce your activity level by 75%, you won't have the symptoms. You won't have the symptoms because you've reduced the threshold. And we accommodate. And so that's I think, a question that really needs to be asked of patients, and particularly women, because otherwise we sort of accommodate our way out of the problem until it becomes really a massive problem.
All right, we're going to have the last word just after the break. You're watching 22 News in Focus. You're watching 22 News in Focus. February is Heart Health Awareness Month, and today we've been talking about the current state of heart disease care, including medical advances, new procedures, and prevention, with doctors from the Heart and Vascular program at Bay State Medical Center. That's our program for today. We want to thank our guests for joining us here, and thank you at home for watching. If you missed any of this, you can of course watch the full program on our website at WWLP.com. From all of us here, have a great day.